Welcome to Tim Finger's Pickleball with the Aces. What we're trying to do here is to show all the technical things in pickleball and also the body parts and how they work. And this is Dr. Ryan Peterson, and he'll tell us about what he'll be doing.
We're going to help you with your body so that you can move and function in a way that allows you to perform at your peak without being injured and to play for as many years as you possibly can enjoy.
What Ryan and I are going to be doing is we're going to just show you the things that we found is the best way to keep from getting injured in pickleball. And the first thing that I always do, and you can do this at home, and probably you do start it at home, you want to massage your foot. Just take your foot, just to warm it up, and you're just going to just rub it and stuff, okay? So the first important part of this massage on your foot is your big toe, okay? So your brain's up here in reflexology, so you want to, just kind of wake that up.
Your first metatarsal phalangeal joint is this big joint in the front of your foot. And as you push off of that, you get 7 times your body weight going through that joint, 10,000 times a day, not to mention all the pickleball steps you're going to do. So this is the most common reason people come in for surgery and for problems is with arthritis and changes in this joint. So mobilizing and moving that joint so that it can get the range of motion that it needs and decreasing pressure on that joint will save you from seeing me in my surgical practice. So in between these long bones are called the metatarsals, the long bones that connect the middle of your foot to your toes. And in between those are an entire series of muscles that move and control and stabilize so that your foot moves and does what it does. In everyday life and shoes, those get kind of atrophied where they just don't work as much. So waking those up and using those internal stabilizers to help your toes will help you be stable while you're playing and avoid those complications of hammer toes, calluses, other things that will happen as your foot is not moving the way that it should.
Thank you. Now you can see as Doc was talking, I was rubbing my foot, so I'm doing the top part, which is super important, your dorsal part. That's the lymphatic system. All that is circulation. You want to get it going. I'm just rubbing my ankle, just warming up, and I'm getting up in here into my calf. But essentially, I'm just warming up at the bottom of my foot so I don't have problems pulling a calf muscle or Achilles. And if you get it going by just rubbing it and doing little like rosettas, they're called, little circles, and taking your hand and just getting your foot going. You can only do this for about a minute, minute and a half.
So now once we get from the forefoot to the midfoot and hindfoot is where all the big bones and all the motor works happen. The most common thing that happens here is that our blood flow starts to back up and you'll see a big red circle around the bottom of your ankle where that blood is pooling. So moving and being active and moving that blood is an important part of health. And then getting those tendons and those reflexes to have that feedback will just avoid that quick step, the quick injury that will pop those tendons or break those joints. And it's quick, it's easy, it's effective. Today we're talking about it a lot, but when you do it on your own, it's a very quick experience.
And then as you're doing it, you want to always have an intention. You always want to thank your foot and both your feet for helping you out when you're playing. Be nice to them.
The whole game starts from the ground up. Your feet are your connection to the court. Take good care of your feet, improve your footwork, and you'll become a better pickleball player.
Now, a lot of people when they're playing, they ask me, Tim, my foot hurts right here. Or when will it get better?
Let's talk about this base of your body, this foot that we enjoy that moves us around on the pickleball court. Soreness is normal. You're going to move and do that stuff, but pain, we want to know about pain and where it happens. So let's talk about one of the first places you might have pain is out in the front of your foot, in the joints called the metatarsal phalangeal joints, and especially the big one. A little bit of tiredness in that is normal, but if you're having sharp, searing pain in your big toe joint here, that can be signs of anything from arthritis to damage to the cartilage to even microfracturing and major fracturing. So if you're having continual sharp pain in there, that's time to go see somebody like me and get an x-ray and make sure there's no structural damage. As long as we know that's safe, we can get you on a program that will move you back into playing again safely. The second most common place to have pain is across the middle of your foot, right across these bones in the middle. Constantly pushing off on your foot puts a lot of pressure on that area. And some of us naturally have longer bones than others called elongated metatarsals, and you'll get a lot of pain right in the center of your foot. That often relates to weakness back in the middle of the foot and also tightness throughout your foot. So if you're having a lot of pain through there, some of those things can be stress fractures, some of those things can be neuromas, and some of those things can be tendon issues in the joint. So if you're having sharp pain in that area, that's another thing to have evaluated by a surgeon. But if we can get you moving better and keep you on the court, that will help. The next place to have pain is as the big tendons come down through your leg. If you're having a lot of pain in the middle of your foot, as our foot moves through these amazing movements called supination and pronation, your foot has 33 joints that do all this fun thing. And so a lot of push off and strain, sometimes you can get a lot of pain through these tendons in the mid and hind foot. And so once again, a little soreness as you're developing your strength is normal. But if you're having sharp pain, especially up through the inside of the arch, that posterior tibial tendon, this big rubber band, can sometimes get stretched and even damaged. So that's another reason to have an evaluation if you're having severe pain in that area. If you're just having some general soreness, we'll talk about how to strengthen your foot. And then finally, the most common reason people see a foot and ankle surgeon is due to heel pain. Our constant pounding of that heel on the ground. Over time, our fat pad underneath that heel gets weaker and weaker and goes away to where it just feels like you're pounding on the ground. And so having good supportive athletic gear that is designed for court sports, not just a running shoe, not just an athletic shoe, getting the appropriate footwear so that you can dampen those forces. And then that pain often comes from a tight Achilles tendon. It wraps all the way around your heel. So this Achilles tendon is the biggest tendon in your entire body, and it wraps around the bottom of that heel. And as we age, those fibers just start to tighten up. And so as our Achilles tightens, it puts pressure on our forefoot, pulls on our heel, causes all these issues. So stretching and working your Achilles tendon is a huge part of foot and ankle care. But once again, if you're having normal soreness working through a program, we can work with that. Sharp pain and things that are stopping you needs to be evaluated by a physician. And we're here to help you with Pickleball Aces. Feel free to send your comments and questions, and we'll help direct you to the possible care that you need.
That is what we're trying to do in these videos, is really help you before that occurs. And we're showing you how to warm up correctly, how to take care of your body, and really what the two of us, what we equal, hopefully, is wellness.
Thank you for spending your time with us on the Pickleball Aces. We're going to teach you how to ace your body, ace your brain, ace your game. Now let's go play.
Yes. Here we go.